Hello, for those of you who do not know me, my name is Dr. Keith Charles. I'm one of the cataract specialists at Mid-Florida Eye Center. In addition, I'm a fellowship-trained cornea specialist. I've been performing cataract surgery for over 25 years, and during that time, I've seen the surgery evolve tremendously. As most of you know, the human eye functions much like a camera. For the eye, light is focused first by the cornea, the outer clear covering of the eye. Light rays then pass through the pupil and are further focused by the lens located in the middle of the eye onto the retina, the back surface of the eye. Any abnormalities of the cornea or the lens will cause light rays to become out of focus and produce blurred vision. My job is to fix these problems and restore vision, in many cases to an even better level than before the problems began. When we are born, the lens inside of the eye is clear and colorless. As we age, the lens yellows and becomes cloudy. The cloudy lens is called a cataract. The treatment for cataracts is to remove the cloudy lens and replace it with a clear artificial lens implant when the blurred vision is bothersome to the patient. Some patients have a very high visual demand and elect to have the surgery early, and others have a lower visual demand and tend to wait until the symptoms are worse. I can give some guidance, however, ultimately the timing of cataract surgery is solely the patient's decision. Because of the many recent advances in cataract surgery, when patients elect to have surgery, they have several choices to customize the surgery. The two main choices are what type of lens implant to get and how they want the surgery performed. With regard to the type of lens implant, in preparing for cataract surgery, several tests are performed to determine the most appropriate lens implant. Not all patients are candidates for all lens implants. Some implants focus for just distance vision, while others focus images from objects at multiple distances. The advantage of this multifocal lens is that many patients can eliminate glasses entirely. There are also lenses that can now treat astigmatism, an abnormality of the shape of the cornea, which contributes to blurred vision. Again, we perform many tests to help determine the best lens implant. The science behind these lens implants is very complex, and therefore it is important to discuss your options with your surgeon and one of our trained surgery counselors. With regard to the type of surgery, the surgery can be done the traditional way with a small diamond scalpel, or can now be done utilizing a bladeless laser technique. In seconds, the laser can make a three-dimensional, self-sealing, valve-like incision. It then makes a circular opening in the cataract and then divides the cataract into 4 small segments, which are then removed with vacuum and ultrasound. The laser can also be used to treat small to moderate amounts of astigmatism. A question I am often asked is, what would I do if the patient were my mother? Well, it just so happens that I performed cataract surgery on my mother last year, and I chose to utilize the laser technology. In my experience, it is safer and more precise. With all the new advances in cataract surgery, we have higher expectations. We do everything we can to reduce or eliminate the need for glasses after surgery. That said, it is important to realize that not everyone can achieve a glasses-free result, no matter which lens implant they choose. As I mentioned previously, in addition to specializing in cataract surgery, I specialize in corneal surgery. There have been many new advances in corneal surgery also. Probably the biggest breakthrough has been the development of DSEK surgery. If the inner lining of the cornea becomes defective, the cornea absorbs water and becomes cloudy. This can cause tremendous blurring. In the past, our only option was to perform a full-thickness corneal transplant. This involved removing the patient's cornea and replacing it with a donor cornea, sewing the new cornea in place with 24 or more sutures. Now with DSEK, we can transplant just the inner layers of the cornea through a microscopic incision requiring only 1 suture. The healing time is significantly shorter and the visual outcomes are far superior. Historically, abnormalities of the front of the eye also required major surgery. Mid-Florida Eye Center is the only eye center in Lake and Sumter counties to possess an excimer laser. This laser can be used in many of these cases to quickly and effectively restore vision without the need for major surgery. If you have any questions regarding any of these scientific breakthroughs, do not hesitate to ask. Grab a cup of coffee, relax, and someone will be with you shortly.